Okay, we're back to notes 3.1. I don't know how I missed that I still had some sections to go in this. So we're back. So we left off on just the acute phase of healing. So the acute phase is characterized by basically 2 to 3 days. It's the first 2 to 3 days of injuries. We have that distinct time where we have an injury. So we'll say sprained ankle. There's an ankle sprain, then we could say, well, like 2-3 days ago, I was playing basketball, stepped on the guy's foot, rolled my ankle. And we would expect this phase of healing to last 48 hours to 72 hours. So, kind of review from a couple of days ago. But remember that we have hypoxia happening, which means lack of oxygen. And we have cell death happening. If you need a refresher on all of this, go back to the first set of 3.1 notes. It's there in the announcements. It's linked to the announcements. Okay, so, and then we went through the signs and symptoms of inflammation. So quick review, that was heat, redness, swelling, and then we have pain and loss of function. So that's all during the acute phase. And again, the time frame is 48 to 72 hours. And that brings us to the second phase of healing. So this is the subacute phase. And this is where damaged tissue starts to regenerate. So cellular debris removed. We're getting adequate blood flow again. The blood vessels themselves in some cases have repaired. And basically, we're getting, this is the repair and regeneration phase. So there are basically two names for each. So the acute phase is the inflammation phase. The subacute is the repair and regeneration phase. Okay, so once those blood vessels have repaired themselves, then we're going to start to get regeneration of tissue. So I don't know what happened to this guy. So I would give you like pictures that are like insane. And I wish I had backstory on some of them. I need to start putting students' injuries in there, so I know what this kid had. We're gonna say that maybe his wife was chasing him with the chainsaw. I don't know, maybe he cheated on her, and so she's like, I don't know, but he has a good long scar there. And at this point he has passed the acute phase, and now his body is going, okay, we're going to regenerate the repaired tissue with scar tissue. Okay, so scar tissue is primarily collagen, and collagen comes from fibroblasts. So there are special types of cells that are specialized, and they're used within this process of regeneration, and they're called fibroblasts. And they are responsible for collagen production. So if you've ever had a scar, so I'm going to find it. I think it's this one. It's sad that I have to like think about it. Oh, right here. This is from the Tongan team. We were playing in Regents. We won, FYI, but the lady that was guarding me had claws, and she just kept clawing at me, and I got a good scar from that. So you can see that fibroblasts went to work there, and I have a scar now that shows not as gnarly as that scar, but it basically was fibroblasts coming together to produce collagen to produce the scar. Okay, so this happens in soft tissue. So the tissue will never be the same as the existing normal tissue. So if you get a scar, you'll notice that scar tissue heals a little bit different. It doesn't look exactly like what it did originally. And again, this occurs throughout the body, except for in the case of bones breaking. Okay, so with bones breaking, we have platelet formation and a blood clot that forms, and then new bone matrix deposition and mineralization, so new bone tissue forms. And you don't necessarily, depending on the break, because if you broke a bone and it was kind of sideways and you didn't get it to track right, so if in the case of, let's pretend like it's a femur, of course that's pretty gnarly. if it's kind of a phalanx, so it's one of these finger bones, let's say that it breaks in half, and you're like, oh, I thought it was just, maybe you thought it was just dislocated. And so you just kind of let it heal on its own. If that's the case and a medical professional didn't try and use some traction to kind of pull it back into place, it can heal at a weird angle. So wouldn't happen with the femur. I can't imagine an instance where you're like, broken femur, I'll just work through it. So that was a stupid example. But in the case of a femur, let's say that you snap a femur, and if it snaps so it's kind of coming like this, medical professionals that have this within their scope of practice will go ahead and use traction and line the bone up right, and then you should get a healed bone. This phase of healing, so remember, acute phase was 2 to 3 days, that inflammation phase. This phase of healing lasts 3 to 4 weeks. Okay, this is the subacute phase, the remodeling phase. So then we're into the final phase of healing, and that's the remodeling or maturation phase. So this, sometimes with the subacute phase, it overlaps a little bit, and it can last up to 1 year. So you still have some activity with fibroblasts and collagen, but really at this point they're trying to strengthen those new collagen fibers. And if you go to physical therapy, they're really going to try and control the motion that you're using throughout this phase, because if they can rehab it properly, then you're going to have less adhesions, which is basically collagen fibers that are too tight together. So I'm going to kind of show you this slide. So a fibroblast nuclei is here between collagen bundles. When you have adhesions, you'll see thicker bands of tissue, and hopefully those bands of tissue are lining with the other tissue. So they'll try and let's say the sprained ankle example, they'll give you like a band. They'll have you put it around your foot. A lot of times they'll be like, okay, go through the alphabet with this band, and they're basically just trying to get you to go. So if this is my foot, and my wrist is the ankle, they're going to say, okay, do plantar flexion, dorsiflexion. They're going to go through eversion and inversion, and basically go through all the normal movements that your ankle would go through, with the idea of making sure that that scar tissue aligns the correct way with the original tissue. Doesn't always happen. You still see thicker bands of collagen. The collagen tends to be a little bit tight when it grows in, and so they just want to work it so that basically you get back to full functioning afterwards. So again, this stage lasts up to 1 year, and this is a good time to bring in Wolff's Law again. So here in this picture, you can see a normal biceps brachii muscle, and let's say this person broke their humerus and were then put in a cast for a set amount of time. And when they did, they're not using that bone and subsequently that muscle, and so the muscle will atrophy. So remember, Wolff's Law is right here. It states tissues grow according to the stresses placed upon them. Well, we didn't have any stress for this one, so it atrophied. So now when the cast is off, we have to go back to hypertrophy, and we need to stimulate the muscle to grow back to where it was before. So in order to do that, we have to give it a stimulus in order for it to grow. So if you remember back to our training unit, we talked about overload. So in the beginning, maybe we have, I don't know, a grandma here that's like, I never really lifted too heavy, but let's go ahead and get some fives. And then when that gets too easy, we're going to go to 7.5s, and then we're going to go to 10s. And pretty soon, grandma's just ripped. And maybe she's beyond her normal biceps brachii muscle. Maybe she's actually like bodybuilding or something. Okay, so Wolff's Law, depending on what their goal is, if they're just like, I just want to get my arm back to normal, they'll have them do activities that will basically lend themselves to getting them back to wherever they wanted to get back to. So if it was a bodybuilder and say their normal biceps was a lot bigger than this, then we'd have to stimulate it and then change the program and stimulate it. And based on Wolff's Law, we'll grow that tissue based on the stress that's placed upon them. The stress is the weights. Okay, the stress could be in the ankle example, going through range of motion and then getting to a point where you're doing plyometrics again and then you're running on the cord again. So that's essentially Wolff's Law. So that is the end of that 3.1. Sorry that I forgot to come back to it, but we're here again. So there it is. And I'll just kind of detail this real quickly on the board because I want you to make a little graphic about it. Okay, so for this injury scenario, what we're going to do is pretend like the calcaneofibular ligament was compromised. So dude went in for a layup, landed on his foot funny, and the lateral aspect of his ankle, so here where the ligament sits, the calcaneofibular ligament was compromised. So in the first phase, there's going to be 2 to 3 days of inflammation just going to work. There's going to be primary cell death and secondary cell death and things torn open and lots of white blood cells going there. There's going to be histamine, all kinds of stuff happening in the inflammation phase. 2 to 3 days. So in this phase, the science still kind of goes, we're controlling for inflammation. So rice, watch for that to change to peace and love like we talked about. But we're controlling for inflammation here. Okay, then we move into the subacute phase that lasts 3 to 4 weeks. So this is kind of just wrapping up in a way that, like, we talked about it in the notes. Just kind of seeing it on the board together. Maybe it helps you. 3 to 4 weeks, we're repairing and regenerating. So we've got, in this case, we're going to have fibroblasts. I hope you can see this. We're going to say those specialized cell fibroblasts are going to go to work, produce collagen, get some scar tissue, and then we're going to move into the remodeling or the maturation phase, which can last up to a year. So hopefully this is a time where you're seeing a physical therapist, because we have in our clinic, we've seen patients where we'll put them on a Biodex balance machine. So I keep doing this because there's a platform on this machine that you stand on, and there's a screen in front of you. And essentially what we're testing is like, well, how good is your balance? So person will stand on there like, okay, can you balance all right? And if they're on 2 feet, they're like, yeah, I got it. This is pretty easy. And then we're gonna say, okay, stand on 1 foot. Okay, stand on 1 foot. And now we're gonna take that platform and make it wiggly. Okay, so you're on 1 foot, it's wiggly, and you can see this screen in front of you that shows you basically like a target with a bullseye in it. You're trying to get it to the bullseye because the bullseye is going to steady that platform. And we have seen people who maybe are 20 years outside of this injury, and we compare the two ankles, and the ankle that had the injury, we can still see some balance problems. And we'll be like, so did you go to rehab for this? And majority of time, they still have balance issues on that one. They'll be like, I went to 1 and then I quit. So here's my plug for physical therapists. They know their stuff. They know about adhesions, fibroblasts, and collagen, and the way tissues heal, and they're working to ensure that that tissue heals as best that it can. So I'm going to say, as a plug for physical therapy, if this happens to you and your doctor says, yeah, and do some physical therapy, do it, because it's going to mess with you for the rest of your life if you didn't. So that's it on this unit, and we'll see you again Wednesday.